All right, so I'm trying to make this look less like a pap smear when you're looking at it, but I really can't. I mean, honestly, I just put cherries on there and, well, it looks like a freaking cherry, I'm telling you. I put face masks over the camera, and that's what you get. Looks like a freaking pap smear. Sorry about that. So, anywho, I was trying to watch our favorite freaking buffoon as I see this freaking clickbait that says, blinding pain. Blinding pain. So, I expect to see, somebody rolling around, screaming. Not some heifer sitting there showing earrings at the camera, blabbing about life. Saying they're in blinding pain, and they're just so used to it that they can just behave like they are. Oh, kiss my fat shiny ass, because I'm telling you, you want to say you're in blinding pain and then act like that? You, ma'am, are the cause of the frickin' opioid crisis, because bastards like you go into the ER and they say, I'm in so much pain. I cannot live like this. I can't live like this. I'm in blinding pain. Yeah, I cannot do anything. I need the pain meds. I need the pain meds. And you go doctor to doctor and you get 4 different classifications of medication. You use them all at the same time and you frickin' die in your sleep, and then it's blamed on the opioid epidemic. So people with bona fide frickin' pain who would take maybe one pain pill very sparingly because they've still got a frickin' life to go through and a job to be coherent at and be responsible with those pain meds. But no, you have to have that whale that is addicted to every freaking thing sitting there gobbing up what she can. So in other words, here we are, middle of the freaking month, which means that she's already blown through her SSI money and blown through the drugs. So she needs drugs. So that was just a little freaking back call for the Lardites to go and steal their granny's pills, steal their boyfriend's drugs, whatever else, and put them in a little envelope addressed to LBL. Because she's in blinding pain and there's no sense in going to the doctor. There's no sense in going to the doctor because every doctor told her to frickin' hose off, to fly a frickin' kite. That the kind of pain that she is describing in this, she is describing this because she knows damn well that interstitial cystitis, while being simultaneously the most painful human condition documented, and that is in the book, a headache in the pelvis, that is quoted by Swedish medical doctors that state that interstitial cystitis is the most painful human condition, okay? Now, simultaneously to that is the most unknown condition, okay? You don't go around, it's not like polite conversation, in the grocery store, like, hey, how are you? I don't know, my freaking bladder is raging right now. It's okay to say my arm hurts, but it's not okay to say, you know what? My pisser is broken, okay? It's just not. So she gets away with that, and it pisses me off because she is using that. She had a little tiny spot of irritated bladder tissue. She bulldozed into every ER when she got to California because there was a whole new crew to give her attention, and rather than any of those doctors wanted to go up that crevasse with their freaking mining light and check out and see what was going on in there, they blew her off to the next ER, to the next ER, to the next ER. So then she had to bring witnesses with her and her freaking camera to intimidate anybody as to saying anything wrong on camera. On the camera. She's doing her YouTube channel. She freaking finally gets one of them to do a cytoscopy because they're not going to go in there with their hands. They'll go in there with a freaking hose and an object. And they show these pictures of the bladder. Well, she's YouTubing. Okay, she's sitting there with a freaking camera at them, which I'm sorry, but if you're in blinding freaking pain from IC, you don't want to hold a motherfucking phone, okay? You want to freaking die. That's blinding pain from IC, okay? I speak from experience. And so anyway, she's got the freaking doctor there, and they put up these pictures of her bladder, and it's clear. I mean, it is clear. And so she says, oh, okay, so I do have the interstitial cystitis. And the doctor's like, well, yes, you have interstitial cystitis. There's a irritated area right here. And he points this little freaking glob right there on the freaking ultrasound. Okay, so if that qualifies for this little piece of irritated bladder tissue, I am disgusted. okay? And you guys are going to get to know why again, because I'm going to tell you again. Because on one of my birthdays, we don't even count like 15 years of my life, okay? I passed 70 kidney stones that they could count, okay? Went into acute liver failure, liver, kidney, heart, all multi-organ failure twice from the damn kidney stones. Had 14 surgeries and ended up with a nephrostomy. You can't even make this shit up. But everybody could not see what I was going through, so they accused me of being a drug seeker because I'm a white woman with children, and apparently we're just out there drug seeking, whatever. So anyway, I had no history of any drug addiction. I've never taken one extra, nothing like that. It's just when they can't see on the x-rays what you're saying is going on, they treat you like that. But anyway, so anyway, she frickin' has this little irritated tissue. When I was going through my things, because I not only the kidney stones, but I have interstitial cystitis, my bladder hemorrhages. The whole entire thing is covered with blisters. So when my bladder expands, like when I drink something, these blisters stretch. Okay? So say that, I wasn't able to go to the bathroom because, let's say I was working and I could not get to the bathroom if I couldn't pee every 2 hours. If I go like 4 hours, those blisters stretch and they bleed. And what will happen is then they'll bleed too much, and then those blood clots get caught in my urethra, and then those blood clots block so I cannot pee. And it hurts, and my bladder will back up. My kidney will start swelling. And the only way to get relief is for a nurse to have a few people hold me down while they take an irrigator and they irrigate my urethra of the blood clots and start clearing it so that blood comes out one side to start getting the urine to flow. And at that point, the ureter will stick to itself, because something along the lines goes where it's just raw, because I've got blisters throughout the urethra too, and so they'll stick to itself. So at that point, then I'll probably need to go and leave the hospital with a freaking Foley catheter bag. And like I say, I got one of those for one of my birthdays. I'm like, hey, tomorrow's my freaking birthday, wonderful, I get to leave with a freaking Foley catheter. I look like a freaking old man. But it's better than having a nephrostomy where I had to have it vented out of my back for 4 freaking months, and a brother-in-law that thought it'd be hilarious to sit there and hit me and act like he was going to get really freaking close to the nephrostomy. A nephrostomy is held in by gravity. It's a hook, okay? A nephrostomy is for end-of-life care, and unfortunately, when I needed one, I was pregnant, and I refused to discontinue the pregnancy, okay? I chose my baby's life over my own. And ethics boards were there. Red Cross had to get my husband from sea, because he was in the Navy, and get him to try and talk some sense into me, because I was dying and I would not abort my baby. So this happens to pregnant women. For some reason, we pass kidney stones more often. And so what had happened was one of the stones was at the junction of where the kidney pushes out. I don't know where they couldn't see it. So I kept going in and going, like, I'm in so much pain. Is this back labor? What is this? And I always had premature labor symptoms. They're like, nothing's wrong. Give me a couple shots of terbutaline or whatever, stop the labor, whatever. But my body was saying otherwise, right? But they were like, there's nothing that can be causing you pain. Well, then all of a sudden my kidney is the size of a freaking basketball, and I'm pissing blood, and not very much of it, drip, 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 but it's not coming from my vagina, so I'm not having a miscarriage. So what's bleeding? Well, it's my freaking bladder again. So they finally do what, because they were limited in what imaging they could do, of course, because I was, at that point, I think I was 7 months pregnant. And so they finally saw the edge of this boulder of a kidney stone that was just at that junction where it was blocking my kidney. So of course, like I say, 4 hospital things of nothing's wrong, you need to go seek attention, you need to go seek drugs, you need to go do that, you need to do that somewhere other than the emergency room, ma'am. Because that's apparently what I do in my spare time. So anyway, they put a nephrostomy in, That's an emergency way, like people who have cancer and need comfort care, who can't undergo a surgery, etc., etc. You can have a nephrostomy. And when I had mine 20 years ago, they didn't have even the components to change it because nephrostomy was supposed to be a very short-term thing. So they put this thing in. It was a hook. And anytime I moved, this hook would move in the inside of my kidney and just grate and grate. But I had my house to vacuum. I had people to entertain. I had kids to take care of. So although my ass should have been in a hospital bed, it wasn't. And I'm still moving around doing my life and going against medical orders and having a nephrostomy, which gave a bag. So the pus and blood coming out would go and empty into a bag, and I'd empty that bag. That's blinding fucking pain. But you know what? Who am I to say that I'm in blinding pain? Because who cares? Who cares? Who cares? I've got things to do. I didn't get SSI, okay? I didn't get SSI, although I have a bleeding colon from Crohn's disease. And of course I have my fibromyalgia, because they'll put that in there because they don't know why on earth I would be in so much pain from passing over 70 kidney stones, sepsis, and everything else. And let's not even count the congestive heart failure, but let's not give me SSI, okay? I had over 29 documented illnesses and injuries that said why I cannot work. They hired the state's vocational expert to say that I could work. This poor man got up and was like, she cannot work. If she works, she's a freaking public health hazard because she's got communicable diseases because of all of her opportunistic infections from being septic twice. She cannot work. But you know what? The judge said, well, I've never heard of this interstitial cystitis stuff, so I'm going to have to look it up. And he came back with his decision 5 days later and said that there wasn't documentation enough, and because that was the presenting thing, he ignored everything else. So I can't ever file again on any of those conditions. And the state owed me, or the country owed me, whatever it is, because I had been working in a full-time those, over $220,000 in back pay. And I should have gotten SSI for life, but you know what? I'm not LBL, so I didn't get it. So I don't get a damn cent. So you know what? I work when I can, and I have to have accommodations that I have to be able to pee every 2 hours, because if I can't, well, then you know what? I'm going to be coming to work with a freaking pee bag. But you know what? My fellow workers, fellow managers, etc., have a real problem with somebody who has such a baby bladder. They have to go pee every 2 hours. Who would have to go pee every 2 hours? You know what shit I get for that? So anyway, I suck it up. I have never taken one more drug than I am prescribed. And when the doctors actually see the shit that I pass, the kidney stones and the hemorrhaging and the amount of blood that I pass, the amount of blood that I lose, they're like, why didn't you tell anybody? You must be in an enormous amount of pain. Why haven't you came and told anybody that you need pain meds? You need pain meds because you're killing yourself holding it in. Well, you think so? Well, you know what? After being called a druggie and a attention seeker one too many times, you just give up. You don't have the gumption that you go from state to state, medical provider to medical provider, like somebody I know. So you know what? Before somebody uses a freaking hashtag of blinding pain, why don't you listen to what blinding pain is? Because those are two examples of blinding pain, okay? I couldn't go up and shove earrings in the camera and say, why won't anybody buy these? I made them special. They're vintage. Vintage, my ass. That stuff, you're sitting there going, oh, who's this by? Oh, Coldwater Creek. Oh, is that just right next to Gucci? Oh, and who's this made by? Coldwater Creek. Yeah, you know what? They're found at your local freaking Kohl's, okay? So that box of freaking jewelry that she was sitting there saying, you know, is vintage, and some subscriber sent her this huge, massive box to go through and sell what she wanted and keep what she wanted. They went and used our freaking Kohl's coupons and stacked them and got this whole box of shitty jewelry for free. But then when Honeybee wants one pair of earrings, you know, to go and pick her worms, she tells LBL, oh, I want that pair of earrings. And you know, she got like that 6-year-old who wasn't going to share. And she goes, no, these are mine. These were given to me. So you know what? If you want them, You can send me an offer for a good price. I'm not going to give them away to you for free, okay? You can send me a fair price offer if you want them. Oh my God. Hasn't the worm digger given you enough? No. And then, see, I've been busy this week. I haven't had time to listen to all of her freaking ramblings, but I just see these hashtags going across, and I saw bad music in a bar. Okay, so the slob goes and wallows up to the freaking bar and sits there and commands people to stay away from her because she is recording on her vlog for her YouTube channel. So all the people around her, are just like, okay, who's that fat man slobbing up at the bar so I can't get my freaking beer? They don't know that, oh, you're broadcasting. And then she has to start grabbing at her eyeballs and her face because the music is so terrible. Well, fuck you. If you want to do better, then get up there and do better. We've heard you sing and we've seen you dance. And unless you want to laugh until you piss, provided that you don't bleed when you piss, then you know what? Shut up about other people's music. Okay? That is so rude to go into a bar and sit there and start grabbing your face that looks like it was already taken off and stretched out by somebody and put back on your head and sitting there and pulling your eyeballs out and sitting there getting all the attention and throwing a fit like a 500-pound 2-year-old that this music is bad. Very, very bad music. Well, go to a different bar. Go home. Shut up. Don't you dare go and criticize or even look at somebody like they're giving bad music. Shut up. That's not nice. I've never seen anybody be so freaking rude in all my life. And, if it's not doing anything, it's showing her age. Because what else do you see when you see some big fat man at a bar gouging their eyeballs out, complaining about the music? You go, you know what? This is somebody who's too old. You just look like she was just too old to be enjoying herself and needed to go home. Or somebody to take her home. But no, she freaking drunk drives the Herbie the Love Bug home. And then on the other video, she's saying, I'm addicted to Ambien. Well, you know what? That's another freaking crawl in my... I'm not out. Who the fuck is prescribing her Ambien? Ambien is a controlled substance. Okay, loosely stated. Just look at what freaking Bobby Kennedy did. He pissed all over the produce. You don't do Ambien. Ambien is so addictive. There's hardly any doctors that will prescribe it. And if it's like for a crisis mental situation. So like say that, something terrible happened and you need to get to sleep for like 2 weeks. It's a 2-week drug. But she's sitting there whining because now she's a victim of the Ambien. Well, so she's drinking, doing Ambien, doing pain pills, doing benzos. Okay, who's giving her these drugs? Because this isn't even funny how much she is getting and the rest of us can't get an aspirin. I mean, come on. She is getting way too much and it does not make sense. I mean, unless she's getting them off the street or from her apartment complex. I bet you they're all sitting there with their freaking... Okay, it used to be the trench coats. Now it's the freaking Section 8 apartments. And oh, you know what? Number 8 has benzos. Number 12 has their granny's freaking opioids. I bet you she goes down the freaking hall and gets herself a freaking smorgasbord of what she freaking wants. Because that's all I can think of when I see her is a smorgasbord. And I'm not kidding you. Those big man hands grabbing at things. And then she has these big piles of food. Okay, ma'am, you had a freaking gastric surgery. Have you never heard of Dr. Now? I would love Dr. Now to have 5 minutes with that bitch. Could you imagine? He'd be like, Stephen Asante? Oh no, Stephen Asante has nothing on you. She is the female Stephen Asante of the 600-pound life. And if you don't know who Stephen Asante and his brother and father are, you might want to Google it, because I'm telling you, she's the missing Asante, because she's got that same attitude, that same helpless victim that the food has been eating them. I am telling you.